Morning, everybody. And thank you, Tiffany, for hosting, for organizing this. Welcome, everybody, to this early Saturday morning health talk by the Taiwan Advanced MedTech Center. Today, we have a very interesting talk, which I think is uh, relevant to many Malaysians. In fact, many Asian patients around the world. What do I do about lump that we see in the front of our neck? And very often we think it's a thyroid lump. And today we have a very important expert who can tell us more about it. Associate Professor Dr. Chen Wei-Jian, he's from Chang Memorial Hospital in Linkou, Taiwan, who is a specialist, internal medicine specialist, in particularly in endocrinology and metabolism from the Department of Internal Medicine in Chang Memorial Hospital. And it's an assistant professor in the division of endocrinology and metabolism there. Interestingly, assistant professor Dr. Chen is also an expert in particularly in the area of thyroid ablation, and also an important part of the thyroid ablation and intervention center. So without taking too much of time, allow me to pass you on to Dr. Chen Wei-Jian. It's Professor Dr. Chan. Please take it on from here.
Can you hear me?
Yes, we can hear you very well.
Oh. Okay, thank you, Tiffany and Dr. Chang, for your introduction. I'm Dr. Chen from Chang Memorial Hospital, Linkou, Taiwan. I'm an endocrinologist and now currently specialized in thyroid ablation. Today, I want to give you a brief talk about the thyroid lump and thyroid nodules. When you have a neck thyroid lump, what can we do about it? Okay, let's start. Usually, in most of the case, when there is a mass or a nodule in your neck, it's mostly thyroid nodules. And thyroid nodules, as you can see in the picture here, which I downloaded from the internet. This picture is drawn from the Cleveland Clinic, and you can find it in the internet too. As you can see, our thyroid gland is located in the middle of our neck, and it's with a shape like a butterfly. Yeah, and it's divided into the left lobe and the right lobe, just in front of our trachea. Yeah, and so in the right side of the picture, you can see there are some thyroid nodules growing inside the thyroid gland. And I'll explain it later. And in most of the cases, thyroid nodules are quite small, and people usually don't have any symptoms about it. But as time goes on, and the thyroid nodules usually grow larger and larger. And when they are large enough, maybe with a size larger than 3 to 4 centimeters, and at that time, patients may feel some compression symptoms, and in that case, we can try to do something about it. So what is thyroid nodules? I think most of you have heard about it, and it's a disease, maybe we can call it disease with a very high prevalence in female, and it's almost 4 times higher than in male. So maybe with 4 girls having maybe a ratio of 4 to 1 maybe, and it depends on different races or countries. And luckily, most of these thyroid nodules are benign. Yeah, and that means it's less than 5% of the thyroid nodules are cancers. So usually, although most of the people, maybe about 40% of the population have thyroid nodules, but luckily most of it is benign nodules. So I think we don't have to worry so much about the cancer risk or anything like that. And in the past, we have found that in the countries or regions with insufficient iodine in their food, that means people with iodine deficiency may have large goiters. And it's confirmed that iodine deficiency may lead to more thyroid nodules growing inside the thyroid gland. So currently in Taiwan, our government adds iodine supplements in our salt, and I think in maybe in other countries they also do this. So nowadays I think there's no countries with iodine deficiency now, maybe except for those with not enough food or condition like this. And in some cases with a thyroid lump, maybe the lump is actually a cyst. A cyst means it's a fully filled cavities. Now, it's different from the thyroid nodules. When we call nodules, when we call some the lesion thyroid nodule, that means the nodule is a solid tumor. But when we call the lesion thyroid cyst, it means it's a cavity filled with fluid. So therefore, in some cases with a sudden onset of back pain with very rapid growing large mass, sometimes it's a bleeding condition in the cyst. In that case, we just need to aspirate the fluid inside using the syringe and the needles, and we can immediately relieve the symptom. So not all the neck lump or thyroid lumps are solid nodules, and in some cases, it's actually just a cyst. Okay. So what symptoms can thyroid nodules cause? Actually, most in most patients, the thyroid nodules are non-functioning nodules, and they are quite small, and usually they don't cause any symptoms. In most cases, they are actually incidentally found during health exams. Maybe we use the ultrasound or the CTs, MRI scans, and we incidentally found some tiny nodules inside our thyroid gland. And in that case, they are actually not palpable. So you can touch them, and you may not have any symptoms. But for experienced endocrinologists, maybe for those nodules larger than 1 centimeter, we can palpate them and tell you that maybe you have thyroid nodules. Okay, but when the nodules are growing larger and larger, and when they are big enough, maybe patients will start to feel some trouble or difficulty in swallowing or breathing. I will show you in the next slide. We will use ultrasound to see the thyroid nodule and see the relationship between the trachea and the esophagus with the nodules. And when they are large enough, the nodules will compress our trachea and our esophagus. So in that case, you may encounter some trouble with the swallowing and breathing. And the other thing is the nerve which control our vocal cord, it just passed through between the esophagus and our trachea. So when the nodule is large enough, they will compress the nerve too, and the vocal cord may have a poor movement, and the voice will becomes the patient may encounter voice change, or we call it hoarseness. That means your voice may be like not quite clean. Yeah. something like that. And the last is when they are large enough, maybe you will have a cosmetic problem. Your neck will look quite thick and may feel some compression and pain in the front of your neck. Yeah, that's for non-functioning thyroid nodules, which most of the people will encounter. Yeah, this slide will show you the ultrasound image we usually see in our patients with thyroid nodules. Yeah, you can see in the left side is our carotid artery, and in the middle, this one is the benign nodules. And this is our trachea, and in this is our esophagus. So when this nodule is grown in our thyroid gland, yeah, our thyroid gland is with this in this part, and it's just next to our trachea and esophagus. When the nodule grows larger and larger, it may compress our trachea and esophagus. In that case, the people will usually suffer from some compression symptoms and maybe some cosmetic problem too. Okay, how do we usually diagnose these thyroid nodules? Actually, currently our treatment guidelines or diagnostic guidelines in several countries suggest we can use the ultrasound, which is a non-invasive method to examine our thyroid gland and see if there's any problem, any disease inside our thyroid gland. Yeah, and due to the advance in the ultrasound image in the recent 10 years, we can detect thyroid nodules maybe even less than 1 centimeters. So it's now the gold standard to diagnose our thyroid nodules. And we can also do some blood tests to see the thyroid function, which our thyroid gland can secrete some endocrine hormones, such as thyroid hormone, which is responsible for our metabolic rate of our whole body. So luckily, most of the thyroid nodules, they do not secrete any thyroid hormones. So, but in some rare cases, the thyroid nodules are we call it autonomous functioning nodules, and they may cause hyperthyroidism or maybe other autoimmune disease which is not related to our thyroid nodules. Yeah, and it's also the standard examination of our thyroid hormone. Yeah, we can check for example, our TSH and the okay. When we see some nodules inside the thyroid gland, and nowadays the treatment guidelines suggest we can do some slightly invasive methods like our aspiration using the needles to aspirate some thyroid cells and see if they are benign or malignant using the cytology method. And quite similar to aspiration, the radiologists, doctors may use the cold needle biopsy, which they can collect more cells and more tissues to see a clear, more accurate pathology report of these thyroid nodules. And I think currently these are the most advanced and standard method when we clinical doctors see thyroid nodules inside your thyroid glands. Okay, so if we found some thyroid nodules or cyst inside the thyroid gland, and if you have some symptoms about that, and we can do some interventions to your thyroid gland to relieve your symptoms. So if the thyroid nodules are small nodules and they after the ultrasound, after the aspiration cytology and the core needle biopsy, the report is benign, and if you have no any symptoms about it, maybe the doctors will usually suggest we can just watch and wait and keep regular follow-up, maybe 6 months, 1 year, or 2 years if they look quite benign and they grow very slowly. And if you start to suffer from some conversion symptoms or some cosmetic symptoms, then nowadays we have two main treatment options to choose. One is the surgical intervention. That means we just remove the thyroid gland and to relieve the conversion symptoms. Another new way is the minimal invasive ablation, which we use a needle with a needle tip which can produce the heat energy in a needle tip, and we can use this heat energy to destroy the thyroid nodules, and later our immune system will absorb the remaining debris, so the thyroid nodules will slowly shrinkage. And surgery and the thyroid ablation is the now most preferred choice of the treatment. And for surgery, there's a few options. One is the traditional removal of the thyroid gland, which will need a surgical wound of about 3 to 5 centimeters. And another is the quite expensive option, which I don't know if you have heard of it, the Da Vinci robotic surgery, which only needs some maybe scar, maybe a wound of about 1 centimeter, several wounds, about 1 centimeters. And another is the natural orifice surgical method, which some doctors now may do the removal of the thyroid gland through our mouth. So the wound is inside the mouth, so it won't cause any scar in your skin, in your neck. That's for the surgery option. Okay, so how do surgeons do the surgery? Which we call it thyroidectomy. So if your nodule is only located in the one side of your thyroid gland, which the thyroid gland is usually shaped in like a butterfly, yeah, we can choose to just remove half of our thyroid gland. So we call it lobectomy. And in that case, the surgeon will only remove half of your thyroid gland, and the remaining thyroid gland, that means only half of your thyroid gland remaining in your body, usually can produce enough thyroid hormone to maintain your normal metabolic function. So in that case, maybe I think only less than 30% of the patient will suffer from hypothyroidism, which those patients will need to take the thyroid hormone, other artificial made thyroid hormone daily. And if the patient suffer from the multi-nodule goiter, which means there's multi-nodules growing inside the thyroid gland, maybe in both left and right lobe of the thyroid gland, and you can the surgeon may suggest you to receive a whole total thyroidectomy to remove the whole thyroid gland from your body. And in such case, the patient will surely encounter the hypothyroidism, and they will need to take the thyroid hormone daily, lifelong. And there's something about the surgery. The surgery usually needs general anesthesia, so the patient will be will need to inject the medicine to make them unconscious, and maybe with patients, maybe patients with maybe heart problem or any other chronic disease, they may increase the risk of this adrenal anesthesia. And surgical and surgery usually they need the insertion site, which may cause a surgical scar, and maybe when some patients with the keloid skin disease, and it will cause a very ugly scar in those patients. But the merit of the surgery is that the thyroid nodules will be removed from your body, so it can immediately improve your symptoms. Okay, that's for the surgery. And the new option is the thyroid thermal ablations, which I also do it in the Chang hospital. And now we have two kinds of heating method. One is the radio frequency ablation, which we use the electric currents to generate heat. And the another way is we use the microwave ablation, which microwave is generated in the needle tip to heat up the water molecules and to generate heat to destroy the thyroid nodules. And the merit is that the scar is very small, as you can see in the picture. We under the ultrasound, real-time ultrasound monitoring.
The microphone is unmuted.
Yeah, we use the ablation needle to insert inside our thyroid gland, and it only cause the scar-like lesion, a scar-like, and actually just like the fine needle aspiration and the core needle biopsy, the scar will be I can call it scarless. Yeah, it won't cause any scar in your neck, and the heat will only destroy the heat will only destroy the thyroid nodule, and we won't cause damage to the normal thyroid tissue. So the thyroid tissue can be preserved, and it won't affect the thyroid function. So for patients doing the thyroid ablation, they won't in most of the case, I think maybe 99% of the case, won't cause any hypothyroidism. But one thing we need to keep in mind is that this method is we use the heat energy to destroy the thyroid nodules. However, we need to wait for our body's immune system to absorb the destroyed nodule. So actually the destroyed nodule will shrinkage, but it takes time. In our observation, the nodules will shrinkage or reduce its volume to about maybe 80% in the 1 year. Yeah, in most of the case, the nodule won't disappear completely, but at least the volume can be markedly decreased up to 80% for doing the thermal ablation in for once. And if you want the nodule to become more you are not satisfied with the result, maybe you can do the ablation second time, and in that case the nodule will further reduce its volume. And that's how we do the thyroid ablation in our daily practice. You can see under the ultrasound monitor, the doctor use the left hand to control the ultrasound probe, and use another hand to hold the ablation needle. And just like the thyroid exam, like the fine needle aspiration or the core needle biopsy, we insert the needle through the neck, and the ablation time usually is about half an hour to maybe with larger nodules, it may take about up to 2 hours. Yeah, and it only requires a local anesthesia. Just like surgery, both surgery and direct ablation is invasive intervention. And in some rare cases, we still can encounter some complications. But actually, for the thyroid ablation, the complications are even less than the surgery, I think. And the main complications we may encounter is the voice change, which the heat energy may radiate further to the other parts of our neck, and if the recurrent laryngeal nerve, which control the vocal cord, when they feel the heat, and we may encounter some transient voice change, which usually recover maybe a few hours or a few days, and yes, the patient may still encounter some voice change, but I think the risk is very low. It's quite rare. And of course, any invasive procedures may encounter pain and bleeding, and it's like surgery. So, but I think it's fine. It's easy to handle, and don't worry about it. Okay, I would like to share some cosmetic improvements after the thyroid ablation. As you can see, this is a neck photo of a 49 years old female. Yeah, from the left to the right, you can see the neck after the thyroid ablation day 1 is still quite large and swelling. As you can see, from the first month to the half year, you can see the neck, the swelling of the neck improves a lot. Yeah, there's how the nodule shrinkage and improve our patient's symptoms. So in our observation and other publications around the world, we can see that most of the ablation with the one treatment sessions usually can reduce the nodules volume for at least 60% to 80%. And I would like to show you the ultrasound, how we monitor the patient's nodules before and after the thyroid ablation treatment. And we can see that there's a nodule inside our thyroid gland is about 2 centimeters large. And this is the pictures before ablation. And the left side is the transverse view, and the right side is the longitudinal view. It's the same nodule in 2 different views. And this is the ultrasound before the ablation, and we can see the nodules become black in color under ultrasound, and it's after the 3 months of the thyroid ablation. And we can see the size is already smaller, and next is after 6 months and 1 year. So the results and the volume of reduction actually depends on the patients. So for very good for cases with very good response, I think and small nodules, there's a still possibility for the complete disappearing of the nodules. Yeah, I want to show you this case. Okay, and this is the last slide. I will turn to summary for the today's health talk. And most of our thyroid nodules are benign, at least with the statistical population. I think most 95% of our thyroid nodules are benign. And usually, when we diagnose those benign nodules, we'll suggest the clinical doctors will usually suggest a regular follow-up, and maybe 1 year or 2 years when the diagnosis is confirmed. And if patients suffer from some symptoms like the swelling and breathing and the cosmetic symptoms, interventions is usually considered. And nowadays we have 2 treatment options, include the surgery and the minimal invasive thyroid ablations. But if we diagnose the thyroid nodules as cancer nodules, I think the usually surgical removal of the thyroid gland is suggested. Thyroid ablation is not currently the preferred treatment in the thyroid cancer nodules. Okay, I think that's the last slide for today. Thank you for listening.
Thank you, Dr. Chen. Thank you for your very comprehensive talk. I just to try to summarize a little bit. One of the reasons why we try to highlight this topic because it's a common finding among, as I mentioned earlier, among many young people, younger people in the community. They find that they look themselves in the mirror and they find, hey, there's a lump small lump that they notice in their front of their neck, and it moves, especially when they swallow, and then suddenly they get worried about it, and it's reasonable to be worried about it and to get have a doctor have a look at it. And even though most of the time this is benign, but it's always good not to ignore it. Have a doctor to look at it. Yeah? What's your opinion about this, Dr. Chen? Dr. Chen.
Yeah. As I mentioned earlier, actually most of the thyroid nodules are benign. But if actually thyroid exam like the cytology or the core needle biopsy is still suggested to confirm whether the nodule is a benign or a malignant nodule. Yeah. So for patients with a newly found neck lump, I think at least they need to go to see a doctor to look at it. And if the report of the ultrasound and the cytology is benign, and I think we can just wait and keep a regular follow-up, maybe yearly or yeah.
And it's interesting also because now there are a lot of new developments. Before this, there's not many years ago, there's not much options available for somebody with a neck lump. It's either surgery or you have to live with it. And then surgery, sometimes the treatment is worse because for surgery, sometimes the outcome is not very good looking. Surgical scar can be ugly, and sometimes surgery has its poor outcome, as in hypothyroidism, or you have to take medications throughout the rest of your life. Unfortunately, this type of surgical lumps are sometimes it affects pretty young people, and having the options of the outcome of having to take medications for the rest of your life is not something which is very pleasant a very good outcome that they look forward to, right? But nowadays with ablation and some other more minimally invasive or non-invasive or even robotic therapy, less invasive, minimally invasive, or even non-invasive therapies are options. Options are available, which is very good. It gives our patients more options to consider.
Yes.
But particularly, I think with regard to ablation, where with a procedure that can be performed with a clinic visit, simple procedure in the clinic visit, and repeated follow-ups, and much less scarring, with also less complications. Also, usually no need for long-term drug replacement therapy. The outcomes are better. Your comments on that, Dr. Chen?
Yeah, sure. And I would like to introduce another treatment for the cyst. I'm not sure if you heard about the external ablation. Yeah, for those thyroid lumps, which is not a solid nodule. I mentioned the thyroid cyst, the fluid filled cavity lesions. Sometimes we can just aspirate the fluid out from the cyst, but if it's a repeated bleeding or some fluid produced inside the cyst, maybe we can also do another minimal invasive treatment like the external ablation. Yeah, we can use the highly concentrated alcohol, maybe larger than 95% of alcohol to inject those alcohol into the cyst to denature the cystic component. It also improves the lump caused by these bleeding cysts. It's also another treatment option for cystic lesion.
So they remove the cyst fluid and then replace with more 95% alcohol.
Yeah. In the old days, these patients need to do the surgery to remove the thyroid gland for the cystic lesion. Yeah. So nowadays
there are
there's
a lot of treatment options today. So I think one of the messages that Dr. Chen is trying to tell everybody is that if anybody notices a swelling in the neck, don't be afraid. Go and see a doctor. There are a lot of treatment options which are available. Most of the time, you do not need surgery. But it's important to see your doctor. That's the most important first step. Very important to see your doctor first. Make sure that it is, have it checked out, that it's not something to worry about. And then have a discussion with your doctor to talk about what are the options available. And there are many options available. And if you need to, there are a lot of groundbreaking options available, both in Malaysia and as well as some wonderful world best options available in Taiwan as well. So any questions any of the members want to ask Dr. Chen? So I think there's a question in the chat by Si Yong. What happens to the alcohol that is in the cyst?
Okay, that's how we do the external ablation. We aspirate the fluid out, all the fluid out from the cyst, and then we inject the alcohol fluid for the half of the amount of the fluid, the volume of the volume of the alcohol we inject is dependent on how much fluid we aspirate from the cyst. Maybe for example, we aspirate maybe 20 milliliters of thyroid cyst from the cyst, and then we inject about half of the amount of the ethanol inside the cyst, and we retain the alcohol for maybe 2 to 5 minutes, and then we aspirate out all the injected alcohol back, and that's done, and that's how we do the external ablation. Yeah. So that's a two way to do. Some doctors may keep the alcohol inside, and yeah, they just inject back the half amount of the alcohol inside and it's done. And some doctors they spray those alcohol out from the cyst. And both is okay. Yeah, both is okay. Our body will absorb those alcohol.
Okay. You might get this a little bit high after that, huh? Okay, I have another question
Okay.
which was in the chat. Somebody asked, Lim Alan asked, could a multinodular goiter turn cancerous? How common is that? Do you have any information on that?
I prepared some I explained before the most of the thyroid nodules are benign nodules, and actually that means the risk of a cancer is less than 5%. And for multinodular goiter, which means there's a multi nodules inside your thyroid gland, and actually in most of the cases they are benign nodules, and we in the treatment guidelines and our own experience, actually those benign nodules have a very low chance of risk turning into the cancer. And the most common cancer type of thyroid cancer is we call it papillary cancer. And it has a very unique appearance in the ultrasound and the cytology, so it's quite easy to be diagnosed. In my opinion, those cancer nodules, they usually born to be cancer. I mean, they don't grow from the benign nodules and turn into a cancer. Yeah, when they just started to grow up, they are actually cancer cells. So I think it's a very low chance of already seen thyroid nodules becoming cancer cells. Is that understandable?
Yeah,
Okay.
thank you. And then the next question is by Eiling, question 4.
This one?
Yeah.
Yeah, actually I mentioned okay, I did mention it. I think those nodules they don't get smaller naturally. They only grow larger and larger in most cases. So if you really want to relieve the conversion symptoms, I think it's only two. There's currently only two ways to treat the nodules, either with surgery or the minimal invasive ablation. Yeah, there's no natural ways to remove the lump.
Right. Okay. Maybe we can go back to the initial questions, question 1 and 2, if you don't mind.
Okay, question 1. Okay. If it's a concern about the thyroid nodules, I think there's no food restriction with the benign thyroid nodules. Regarding the iodine supplements, I mentioned in our slides that the iodine deficiency will cause the thyroid nodules, so another point of view is that how about the excessive iodine intake? Yeah, currently there's no proven evidence that with excessive iodine intake, there's a proven relationship with the growing thyroid nodules. There's not proven yet. So I don't think there's a need to restrict the iodine intake for those patients with thyroid nodules. And the another concern is that for patients with autoimmune thyroid disease, iodine may cause the autoimmune inflammation to exaggerate. So in such case, for patients with autoimmune disease, we suggest a less iodine intake in those patients. Yeah, but for nodules, I don't think there's any special restrictions regarding the food intake.
Thank you. Yeah.
And for question two about the Qigong and yoga, okay, I'll explain the TSH count first. If your doctor, if you do a blood test and the doctor tell you have a low TSH count, for one condition, that means you have a hyperthyroidism, maybe, and if you have a low TSH and a high T4 level, that means you have a hyperthyroidism. And then the doctor will need to find the cause of the therapy, the hyperthyroidism. Usually, those cases are the Graves' disease, the autoimmune thyroid-induced hyperthyroidism. And in some cases, it's the functioning nodules, which usually is benign, and those nodules will produce thyroid hormones, which will cause the patients to experience hyperthyroidism. And if you do not have any symptoms, but your lab reports show the low TSH count, sometimes it's because I would like to say that TSH is produced by our pituitary gland in our brain, and our pituitary gland release the secrete the TSH hormone in a pulsatile secretion. Yeah, sometimes maybe when we do the blood test, is the lowest secretion time during the pulsatile secretion. And so if you don't have any symptoms and just slightly low TSH and normal thyroid function, normal T4, normal T3, I think it's usually a normal condition. Maybe you repeat the lab test again, and then the TSH level will be normal. Yeah, most of the time is like that.
Right.
And
But
there's yes.
Sorry, in a patient with a low TSH and a thyroid nodule, isn't that a clear indication for removal of that thyroid nodule?
No,
Because
they are
doesn't that
not
suggest
related.
that thyroid nodule is toxic?
It depends on the T4 count. I mean, the low TSH with the high T4 means you have hyperthyroidism.
Yeah.
And then we need to find the cause. Most of the cases is actually the autoimmune disease, which we call the Graves' disease. And very rare cases is due to the functioning nodules. And for the functioning nodules, the treatment include the radioiodine, and thyroid ablation is also nowadays a preferred treatment for the functioning nodules. We just need to destroy the nodules alone. We don't have to do the surgery.
I see. Okay.
Okay, and currently I don't think there's any evidence for the Qigong and yoga on the TSH counter relationship. Yeah.
Okay. Thank you. Okay. I'd like to open the floor to any other questions from the other members of the group today. Any other questions for Dr. Chen? You can either unmute or you can type in the chat. Okay, if there are no other questions, I'm just going to spend 1 or 2 minutes just to share some information about the Taiwan Advanced MedTech Center. As you know, this center is promotes tries to connect the advanced medical technologies that are available in Taiwan to the Malaysian community, but also to try to make available the advanced medical services that are available in Taiwan, available to the Malaysian public. So for Malaysians who are keen at seeking some of the therapies which are available in Taiwan, but maybe not available in Malaysia, and would like to get more information or would like to find out more, please try to contact us at the Taiwan Advanced MedTech Center. Come drop by and ask us any questions that you would like to ask. Find out more information about any medical services that you would like to ask about. And we'll be very happy to help you out with some of the services which are available in Taiwan, in particularly in Chang Foundation, Memorial Hospitals, all in Linkou, in Kaohsiung, and all the services that they have in their hospitals in Taiwan. And they are world top in many of the services that we don't have in Malaysia, and they are world top in some services in the whole world, particularly in areas like proton beam therapy, in areas like liver transplantation, in bone marrow transplant, in liver therapies, and also in some other transplant services. So please, if you're interested, if you have some queries, please feel free to drop by and drop us a line, or just drop by and visit us and ask us some questions. Okay. So if there are no other questions from the group, I'm just looking, there aren't any. Please join me in sending a thank you to Dr. Chen Weijian for spending your time with us, sharing your knowledge and your expertise, in particularly in this area of thyroid ablation and the wonderful work that you're doing with Chang Memorial Hospital. And I wish you every success in 2024. I wish you all wonderful upcoming Lunar New Year, and everybody a wonderful 2024. So with that, a very big thank you to everybody, and wishing you all a wonderful weekend and a wonderful week ahead. Thank you all. Goodbye.
Thank you. Bye-bye.